Well, the month of October is certainly a time to recognize and bring awareness to breast cancer. Breast cancer can be treatable, especially if it's caught early. Joining us today to discuss the importance of screening is Dr. Krishna Patel, head of breast imaging at Midstate Radiology Associates with Hartford Healthcare. Thank you for being with us, doctor.
Thank you so much. Happy to be here.
A reminder to get everyone scheduled for those mammograms, but why is imaging so critical and what does it really show you?
So imaging really is the best thing that you can do for your breast health. A screening breast mammogram is recommended for most average risk women annually after the age of 40. Most women can't actually feel or see an early breast cancer, which is why mammograms are so important. They help to see breast cancer when it's super early. When we catch breast cancer when it's early, it helps with treatment outcomes and treatment options.
Yeah. So how does one know if they might need additional screening tools?
Sure. So there are two groups of women that might need additional screening tools, which are women with dense breast tissue and women with high risk. Dense breast tissue is seen in a large population of women. About 40% of women, which is almost half of all women, have dense breast tissue. And for those women, they have a lot of dense fibroglandular tissue on their mammogram, which can make it pretty hard to see any small cancers. There are things like 3D mammography or tomosynthesis that help with finding those breast cancers on the dense breast tissue, which layers through that breast tissue, which is good. We also recommend that all women that have dense breast tissue get an additional screening breast ultrasound, which also helps to see through that dense breast tissue. As far as high-risk women, that's defined by the American College of Radiology as women that have a 20% or more lifetime risk of developing breast cancer. And for those women, we do recommend that they get high-risk annual screening breast MRI. And breast MRIs are great. They are the most sensitive exam that we have for catching small breast cancers, but they are an expensive exam, and sometimes the insurance companies won't cover them. An alternative to that is something called contrast-enhanced mammogram, which we now newly have available in the state at the Comprehensive Breast Center at the Hospital of Central Connecticut, associated with Midstate Radiology Associates. And again, it's a great tool to have for women that need high-risk screening.
All right, and just lastly, quickly, as we will probably run out of time, but what can women expect when they go in for a screening? I know I get mine, and I think it's no big deal at all.
Yeah, a screening breast appointment is really quick. It's about 15 minutes. And, when you go in, they might ask you about your breast history, whether you've had prior surgeries or other biopsies. They might ask you about any new symptoms that you might have, like palpable lumps, nipple discharge, or any new pain. But then after that, the actual imaging portion of it is probably the worst portion of the exam, where you are held in compression, but it's only for a few seconds for each view that you have taken. And then after that, it's done.
All right, yeah, definitely get those screenings on the books. Thank you, doctor, for being with us.
Absolutely.
And please visit hartfordhealthcare.org/breast cancer. Lots more information there, and I'm sure once you're on the website, you can make those appointments.